Good afternoon. We should also be live online. We've got quite an audience and a couple of speakers online. So for your information, this is the camera for online participants, and we're going to have a few slides, and you'll see our speakers on the screen in a few moments. Should anybody need practical information, the bathrooms are downstairs, and there'll be a light lunch served after the panel discussion. Wonderful. As a proper welcome, my name is Neira, and I'm Head of Health at the Clean Air Fund. Delighted to see you all this afternoon. Thank you so much for coming on a WHA Friday. We're going to kick off in just a moment with our wonderful In Conversation session, which I will introduce very shortly, with Right Honourable Helen Clark, former Prime Minister of New Zealand, and the chair of the Our Common Air Commission, and Maria Neira, obviously WHO Director for Environment, Climate and Health. So we'll kick off that in just a second. First of all, just a couple of words. Why are we talking about air pollution at our World Health Assembly? I think probably everybody here knows the facts and figures already. But just to reiterate, because it does occasionally take people by surprise, air pollution has now overtaken tobacco as a risk factor for premature death and for the burden of disease worldwide. Latest global burden of disease figures of 2021 tell us that over 8 million people now die prematurely from air pollution causes every year. This is huge, more than tobacco, as I said. Also, in terms of maternal, newborn and child health, clearly also a topic at this WHA, air pollution is now taking the life of a child under 5 every minute of every day. This is huge. Last year's State of Global Air study was co-produced with UNICEF to emphasize the impact on babies and children. This is a very tractable problem, air pollution. Millions of lives could be saved every year by moving towards the WHO air quality guidelines. We'll hear all about the economic case for that this afternoon. Dramatic, rapid improvements in air quality. They are feasible, they're affordable, and they're a really smart investment, as you're about to hear. So without further ado, I will open we were going to call it a fireside chat, but that seemed horrendously inappropriate when we're talking about air pollution. So it is very much a smokeless fireside chat with Helen Clark and Maria Neira. We'll call it In Conversation, with two real advocates for the field, two real champions for air quality from the health community, from the health and development perspective. And I'm really delighted to hand over to the two of you. We're honoured to have you here.
Thank you. Yes, fireside definitely wasn't the best term. But, well, great to be here and great to really see the way Maria and the team at WHO have got air pollution firmly on the agenda. Because if health doesn't pick it up, who does? You know, I think one of the reasons it's gone sort of under-addressed for so long is it fell between so many cracks. It wasn't really environment, you know, health needed to get a good focus on it, and I think we're seeing that happening now. And I'm going to kick off the conversation really with a question to Maria, which says, look, you've just had the global conference in Cartagena. Government's endorsed a target to halve the health impacts of air pollution by 2040. It's a pivotal moment. You've got a big agenda down at the Assembly as well. So tell us how we're going and how confident you're feeling about how we're going to move ahead.
Let me tell you that it's going very well. Is that okay? Yes. No. Okay, good. Thanks for believing me. But let's now put a real picture. Thank you, Helen. And it's really a pleasure to be with you on this pleasant and positive conversation without fire at all. Yes, a couple of months ago, we have this second global conference on air pollution and health in Cartagena de Indias in Colombia, probably the place where such a positive and good and nice one that conducted to very good commitments. Many of you were there, so I'm sure that you can say fantastic things about the conference. Many of you supported this conference, both politically and financially, so thank you very much as well. But the most important thing is that we align at the conference all the science and the political willingness, because science is very strong. You hear it. We are now the first risk factor. We don't want to compete with tobacco. I remember years ago, we were saying that the tobacco people were telling me, no, we have more deaths than you. Say, guys, this is not a competition to see who is killing more than others. I don't want to kill people. On the contrary, I want to use this figure to start to do something big and ambitious on reducing that. So the conference agree on this target. Some people say this is very ambitious. I think it's not ambitious enough. I mean, reducing by 2040, by 50% the mortality, do you really think it's ambitious? I think we can do much more. So this is the minimum, but we are not stopping countries to go for much more. But the good thing, Helen, is that now I don't think anyone can use excuses because the science is there, the numbers are there, the resolutions are there, the air quality guidelines are there, the community is there, the mayors are committed, the politicians. Now we need to do something to elevate that, and maybe with these conversations and this type of discussions we are having here, we will find it. So at the Assembly, we have both resolution on the Global Plan of Action on Climate Change and Health and a roadmap on air pollution, where we are asking countries to take certain type of actions, and we are really very much convinced at the moment that this is going to be approved and endorsed. But it's just a resolution. Then we need to go for much more, and hopefully this will be the case.
Well, I know you're going to be keeping a stick in the back for ambition. Don't destroy the phone as we.
Yes.
Send
it up.
So on our Common Air Commission, which I co-chair with Soumya Swaminathan, who's very well known in these circles as well, we sort of started our discussions on why there hadn't been a lot more attention given to and more investment in addressing the air pollution challenge. And as Maria said, we've got all the facts and figures and the evidence as to why things need to be done, but somehow it wasn't moving. And so often when you see a cause that's right, but there's not much action, you think, well, what will sway people? And it's often the economics. What's the cost of not doing something? And so we have actually very good allies at the World Bank on this issue as well, and they produce good facts and figures. So they estimate that PM 2.5 pollution costs the global economy 8.1 trillion a year, which is about 6% of GDP. Now that's the sort of thing that gets finance ministers interested, isn't it? Even if they're not caring too much about the air, they do care about the money. So, and of course that loss is much bigger in say heavily polluted areas of South Asia. So we started honing in on these economic arguments and seeing clean air itself as an economic asset, because things are better if you have clean air. Not only the benefits for human health, but the benefits for human health are also benefits for economies. If people are sick a lot because of bad air, that affects productivity. That becomes an economic issue. If people are sick a lot because of bad air, whether they're child or adult, that increases your health system costs. This is preventable. So we've been, coming at it from some of these angles, making the case, the economic case for investment in clean air. And I think, Maria, that aligns really with WHO's co-benefit focus. Do you want to talk a wee bit about your thinking on that?
Yes, thank you. And I'm so pleased that you mentioned all of this economic asset, and you see it so clearly, Helen, because you have been a prime minister, not on a small country. You have been the head of UNDP. You have been many roles. So you understand how we can link those two things, the very heavy evidence. If we think about the number of deaths, the premature deaths that are occurring every year, it's like cleaning Madrid from his inhabitants every year. Imagine. Everybody knows Madrid, of course. Huh? Okay. And you don't want Madrid to disappear. It's a super funny place. So no way. So definitely this economic argument, the economic asset is extremely strong, and we need to probably use it more. We did recently the investment case in WHO, I think it was less than 1 year ago. And when we look at the climate change and health, we provide 5 arguments saying, well, if you put in place these 5 interventions in terms of climate change and health, only with those 5 interventions, you will save 2 million lives every year. Most of those savings of lives are coming from the reduction of air pollution. And actually, any year we go to the COPs, for many years we were taking a huge sculpture representing our lungs, a beautiful one. And we put that in the middle of our health pavilion. Many of you saw it. It was really impressive. The message was very clear. Guys, the price is already paid by our lungs and our hospitals. This famous Stern report, of course, Nicholas Stern was brilliant, that report, remember, on the cost of climate change. Little detail, didn't mention the externalities on health. So didn't include how much the hospitals, the health system is already paying. So maybe this is something that we need to keep in mind. When people do these economic studies, normally they do not consider the fact that if you don't do something about the air pollution, that person will develop a chronic disease, because all of diseases caused by air pollution are chronic if they don't kill you. And then the hospitals needs to pay, and the price is really very high. So those externalities are good. So it aligns very, very well with WHO, and we are ready to use all of those arguments in a very strong way.
And it's aligning with the inroads that have been made now at the climate change COPs, specifically on the health track, right? It's taken a long time to get there. I want to acknowledge Marina Romanella from the Lancet Countdown, executive director of the project there, because the countdown's become, the very authoritative annual report on the health impact of climate change and why we need climate action designed specifically with the health co-benefits in mind, because that actually hasn't been at the top of mind often for climate action. It's been more focused on the environmental issues, which are very important, but we need to design explicitly for health as well. But just coming to what sort of level of investment there has been in addressing the air pollution challenge. I mean, it is quite pathetic, the amount of investment, I have to say. I mean, the figures I have are that between 2018 and 2022, which is a 4-year period, just under $16 billion of international development finance went into it. Now, that's under $4 billion a year. I mean, for something that's become, as was said, one of the leading causes of preventable death globally. And the most polluted countries, including those in South Africa, were getting some of the least support. In fact, to drill down further, of 7 of the 10 most polluted countries got less than 1% of the air quality funding. So it's been a pitiful investment. So out of the discussion in our commission, when we issued the papers we've been issuing, we said that achieving clean air has to be embedded into core development financing strategies. We need clear metrics, and that's something I'm sure Maria will want to comment on in a moment. And we may well need, within the funding envelopes that are out there for development finance, some dedicated pillars for short-lived climate pollutants like black carbon. And I was going to ask you, Maria, to come back in on black carbon, which has often been overlooked. It is such a major health hazard and climate forcer.
Definitely, and I'm very happy to say that your analysis of the financial situation is as dramatic as it looks like. I mean, when you look at the first risk factor for death and disease. Thank you. That was very discreet. Thank you. Lovely. Yeah, when you look at the investment we have at the moment on the first risk factor for health is ridiculous. It's less than 1-2%, and climate change, all the environmental health issues, including air pollution, while the benefits could be enormous. So what we are asking countries to do on the roadmap they are approving, hopefully on Monday, is exactly that: endorse the air quality guidelines, the standards of WHO. A couple of things. One, at the global conference in Cartagena, Helen, one of the most beautiful slides ever I saw was the Vice Minister of Health from China showing a slide where you can see how they have been able to reduce air pollution, and we have evidence, so it's not just a greenwash. Air pollution going down, GDP going up. I think that was an incredible marketing for all we are trying to achieve here. We need to demonstrate to the countries, as you say, the economic asset. Having clean air is nothing but a good development and definitely generate benefits. And the other one is that the European Commission, they just endorsed a new directive on air quality, very close to WHO standards, of course, not there yet, but if they go for it and they endorse that directive, which is the case, the Parliament, can you imagine the health benefits that this will represent? The implementation of this directive on air quality will represent a decrease on the cost by all the health systems in the European countries that will endorse that directive. And of course, a benefit, a health benefit, which is amazing for the population. So those things are already happening. This alignment within the politics, the economics, and science hopefully is happening. Obviously not at the speed nor at the ambition level that we would like to, but it's happening.
So to get action, we need data and we need standards. And I'm told that more than half of the world's countries don't yet have PM 2.5 standards, and many are not monitoring air pollution. And of those that do, very few publish open data. So we've got some work to do. And the call from the Common Air Commission was that all countries should adopt the WHO PM 2.5 guidelines or interim targets towards them by 2030 and monitor and report progress annually. And where monitoring is lacking, let's open up and share data transparently. So would you like to perhaps comment a bit about this, Maria?
Well, what can I say? 100% in agreement with the Commission, no doubt. We will like countries to endorse WHO's air quality standards, or at least the interim targets. What we can commit in exchange to those countries that will do that is that we can monitor the health benefits that will be obtained. And you know, if you are a mayor of a city, maybe by using those health benefits, we have some examples already, the mayors that understood that there is a recent paper in the Lancet about Anne Hidalgo and the things that she's doing in Paris, using those standards. Come on, the health benefits are enormous. And I'm sure that that can result in votes for the mayors as well, which are probably something that will interest them, I'm pretty sure. But this is good for us as well. So endorsing the air quality guidelines, and certainly the monitoring needs to change and improve, and we need to monitor everywhere, and particularly monitoring as well the good results that we will be obtaining if everybody endorse WHO standards.
So in somewhat bleak times, we always need hope. And I think in this area, it's starting to get more attention. The evidence is clear on the health side, on the economic side. The public actually like clean air. You know, publics will react positively, I believe, to measures. And there's platforms, the World Health Assembly, obviously backed by all the work of WHO. Can we bring it to the General Assembly more? Can we get the G20 seized of the importance of it? We've got health tracks at the COP. You know, there's a number of opportunities, I think, to sort of focus on the real need for investment in the area. So my closing question to Maria will be, what gives you hope that we're going to move ahead?
You know, Helen, when you work on public health, you need to be a pathologically optimistic person. No choice. I mean, it's so stimulating public health. And, you know, it took us only 50 years to do something on tobacco. Only 50 years. But, and still, those companies are making a lot of money. I really hope that on clean air, the demands by the people will be different, because tobacco is a behavioral thing as well. But clean air is something that you don't choose. So when people understand that this is linked to all the diseases that are making you coughing and having problems with your respiratory system, the others you might not see it immediately, then my only explanation is because air pollution is affecting our intellectual coefficient as well. That is maybe the explanation why we are not doing more, you know?
Oh my goodness.
But this is not scientifically proved. Even Marina have not been able to prove it in the Lancet Countdown. But inflammatory issues, yeah. But yes, I keep optimistic because I have all of this engagement, common air, WHO, all the associations, civil society, everybody's now in agreement. Obviously, the Lancet countdown. Climate change give us an opportunity. All the COPs, we will be very strongly there arguing that whatever you negotiate on reducing emissions, please understand that you are negotiating with how many cases of asthma we are going to have, how many cases of lung cancer. So we are negotiating with our health as well. So I remain optimistic, for good or for bad. This is what it is.
And on behalf of all pathological optimists, thank you.
Thank you so much, Helen Maria. It was phenomenal and wonderful to hear the note of optimism. Thank you. If you want to stay with us, and please take the seats at the side. And I'm
Get down.
yes, you've got it. Christie, do you want to pop up this side? Wonderful. Quick change, and we are going to be joined on Zoom by our two other panelists. Thank you so much again, Helen, Maria. This was really wonderful. We're going to crunch some numbers in the panel and hear about some new evidence that's coming through on the investment case for clean air. Could we have the next slide up and see our online speakers, please? There we go. Let me introduce the next panel. So with me in the room is Christie Oliver, who's from Haleon, who will speak about some investment case work that they've been doing as part of the Health Inclusivity Index, which has some truly fascinating and, as you would imagine, very large numbers about the health benefits to be had from cleaner air. Online, we're joined by Helena Naber, who is a senior environmental specialist at the World Bank, who will talk about a flagship report launched very recently, also looking into the investment case, and Natalia Linou, who is Deputy Director of Health and HIV at the UN Development Programme. So first of all, I'll start with Christie in the room. Can you tell us a bit about your Health Inclusivity Index and what it's found in terms of the economic benefits of cleaner air? Thanks so much.
Absolutely. Thank you very much. Can people hear me okay? Fabulous. Thank you. So before I get into a bit about our research, I'll just introduce you to Haleon for those of you not familiar. So we're a global... Is that not working? Fabulous. Thank you. We're a global consumer healthcare company dedicated to delivering better everyday health with humanity. And we have brands in a number of categories, including respiratory health and pain relief, as well as oral health and vitamins and mineral supplements as well. So to deliver our purpose, we're committed to addressing the social and environmental barriers that hold people back from better everyday health. And our single-minded social impact focus is on improving health inclusivity. So we recognise that disparities in health outcomes persist and in some areas are increasing, and these significantly affect communities and economies. So we're committed to playing our role in addressing this gap. To this end, we've been collaborating with Economist Impact for over 4 years to support the Health Inclusivity Index. This data-driven research aims to understand and measure health inclusivity and its drivers, informing policies and actions to improve health inclusivity for all. This is a very timely conversation, as just last week we launched our third phase of the index, which quantifies the health and economic benefits of addressing inclusivity gaps across 7 common health conditions. And it really resonated with what Helen said and what sways people. And this was a lot of our discussion when we were deciding what we wanted to focus on for the third phase. And we recognized that money talks. So we wanted to understand the economic impact of 7 common health conditions if we were to address inclusivity gaps. So as we do this, we've considered the benefits of closing gaps for the overall population and also for specific groups who face particular barriers. These groups are older adults, women, people on lower incomes, and those with low health literacy. As part of this work, we explored the economic impact of reducing PM2.5 levels to WHO guideline levels across our 40 index countries and found that this could result in annual healthcare savings of over $100 billion. The US, India, and China stand to gain the most from achieving the WHO air pollution targets, the potential boost to their economies being $5 billion, $12 billion, and $53 billion, respectively. Further to this, we were able to conduct a cost-benefit analysis across the 40 countries, and we compared PM2.5 abatement costs using carbon emissions as a proxy with the health benefits. And our analysis showed that 9 countries, Bangladesh, Costa Rica, Cuba, Germany, Italy, Rwanda, Switzerland, the UK, and Ukraine could achieve a return on investment within 10 years or less by reducing PM 2.5 levels in line with WHO guidelines. These countries represent a range of income levels from low income in Rwanda to high income in Germany, Italy, Switzerland, and the UK. So it's our hope that through this research, we provide further evidence of the investment case for clean air.
Thank you so much, Christie. Excellent. I will come now to our panelists online. Natalia, we can see you in the room. Hello, good to see you. A question to you about your work at UN Development Programme. Governments are increasingly asking for your assistance and advice to understand the burden and the benefits of air pollution and acting on it. Can you share some examples from your recent work supporting governments? Thanks.
Sure. Good morning from New York, colleagues. Sorry I couldn't be there. And Nina, thank you to the Clean Air Fund. And it's so wonderful to see everyone. Sorry we can't see everyone in the room. So, for UNDP, clean air is clearly a human right, a universal need, and a shared responsibility. And as Helen said, it's an economic asset. And we believe that it's critically important to highlight the health harms, which are so profound and so unequal, while also simultaneously talking about the ways that air pollution directly stifles labor productivity, as well as participation. It strains already stretched health systems and slows economic growth. And we agree, the conversation this morning about the fact that it often falls through the cracks because different ministries all contribute, but it's not a budget item on any of them. They don't want to take sole responsibility because the budget, it would cost sort of a lot and require collaboration. That's a challenge. And I think a challenge that we haven't talked about is also that it's a transboundary issue and that there is industry interference that can block ambition as well as hinder enforcement of existing regulations. So those are two topics to keep in mind when we're thinking about the economic costs. But, UNDP has been working along with WHO as well as the UN, the NCD task force on non-communicable diseases, as well as the WHO Framework Convention on Tobacco Control, the Secretariat, to conduct investment cases in over 70 countries on different health issues. These have primarily been related to NCDs and mental health. But since 2020, we've been focusing on air pollution with the support from the European Union and now more recently by the Clean Air Fund. So in the last 5 years, we developed a new methodology to conduct the quantitative modeling on the economic burden, adding new models to the WHO's BARHAP to examine burdens from household air pollution also, while also modeling the return of investment of scaling up specific interventions and doing sort of what we call the context analysis to look at the political economy. We piloted this methodology in 4 countries, and we're rolling it out in 2 more right now. But over the last decade of doing investment cases, I think we've learned 3 things that are important for this conversation. One is that, investment cases do reframe action as an investment, not a cost. And for example, in Mongolia, our investment case showed that air pollution is responsible for a staggering 9% of national GDP lost each year. So it has made a compelling case for why action on clean air is a win-win for healthy populations and healthy economies. Importantly, investment cases also provide rigorous country-specific evidence to guide policy planning and decisions. And I think while in global fora we talk about the 8 million deaths per year or the 6% of global GDP that is being impacted, policymakers at the country level want their data. They want to know how is it affecting their people and much more granular information. So in Ethiopia, for example, our air pollution investment case showed that household air pollution claims over 39,000 lives and costs around 8 billion annually, while outdoor air pollution adds another 25,000 deaths and 800 million in losses. So this can help them prioritize the indoor target, for example, helping Ethiopians transition from biomass to electric cook stoves. So that granular national data is quite critical. But I think what is often overlooked is that these investment cases provide a common language for the health ministry to talk to the finance ministry, to talk to agriculture, and help basically create the basis for which a platform for further coordination. And what we found is that what is most important is pairing this investment case, this concrete financial sort of modeling with a multi-sectoral action plan. And we saw that in Ethiopia, for example, the investment case directly led to an action plan that was endorsed by 7 ministries, led by the EPA. And therefore, that can lead us to actual sustainability and action. And I think I want to highlight here the role of civil society. We need civil society to be there because oftentimes these processes are mostly across government, but to keep putting the pressure on. And in Ghana, the Breathe Accra initiative is bringing together nearly 30 stakeholders. And that includes ministries, municipal assemblies, civil society, and academia. And we think that this multi-sectoral, multi-stakeholder platform is what is needed. And with the support of CAF, thank you, we're able to do the modeling for air pollution reduction, but those have to go hand in hand. I'll stop there in the interest of time.
Thank you, Natalia. Great. I'm going to come back to you in a second with another question, if that's okay, time permitting, and Christie as well. But first of all, I want to bring in Helena and hear about the World Bank, their recent report, which you led, I think, on accelerating access to clean air for a livable planet, which looks at the affordability and feasibility of very significant reductions to harmful air pollution exposure. Over to you, Helena. Thank you.
Thank you very much, and sorry that I could not be with you in person, but I'm very glad to be joining online as well. So our report, it started from the numerous studies that have already been carried out that looked at why air pollution is important, the impact on air pollution on the health, the impact of economy, and we looked at what can be a cost-effective solutions or approach to address air pollution. Our focus was on fine particulate matter, PM2.5, and we focus specifically on outdoor air pollution, understanding that, of course, the indoor air pollution also is important, but the focus now was on outdoor air pollution. And we did analysis on what is the current exposure, how many people are exposed to levels above interim target 1 of the WHO, 35 micrograms per cubic meter, and interim target 2, which is 25 micrograms per cubic meter, now in 2020, and then did modeling for 2040. And what we found is that today, almost 2.3 billion people are exposed to outdoor fine particulate matter above 35 micrograms per cubic meter, and over 3.3 billion people are exposed to PM2.5 levels that are higher than 25 micrograms per cubic meter, which is the WHO interim target 2. And this problem will only get worse. So even if countries successfully implement all their energy, climate, and air pollution control policies and measures that are announced or planned now, over the next 15 years, that is by 2040, we will still see a rise of 21% in the number of people who are exposed to PM2.5 levels above 25 micrograms per cubic meter. And this will be due to combined effects of population growth and economic expansion. And as a percent increase, the highest will be in sub-Saharan Africa. And globally, over 50% of PM2.5 exposure is from anthropogenic sources. Of course, there is exposure from desert dust, but almost more than 50% is from anthropogenic sources. And this is why I think one of the speakers mentioned on the importance to decouple economic growth and population growth from air emissions. So it's very important to see economy grow, but air emissions reduce. And one thing that the analysis also found is that almost 30% of the exposure from outdoor air pollution is due to residential heating and cooking. So that's why it's important to address indoor air pollution, which contributes, of course, to the indoor exposure, but it also has impacts on outdoor. And this is one thing that our analysis found, that actually reducing the number of people exposed to PM2.5 concentrations above 25 microgram per cubic meter by 2040 globally by half is both feasible and affordable. And the best approach to do that is through an integrated approach, which combines conventional air quality management measures with energy and climate policies that are aimed at achieving goals like energy independence and climate policies. And this would help to reduce. So if we have the current scenario, we will have by 2040 about 6.2 million mortality due to outdoor air pollution alone. And with an integrated approach, this can be reduced to 4.1 million, or a 35% reduction. Of course, if we add also the indoor air pollution, that would be a much higher averted mortality. And the economic benefits based on the value of averted mortality alone, so that does not take into account the morbidity or the indoor air pollution, will be between 1.9 and 2.4 trillion in 2040, which is equivalent to about 0.8 to 2.1 of global GDP. And of course, the integrated approach would also have positive reduction on the greenhouse emissions, so it could reduce black carbon by about 2/3. So there is definitely, it is feasible, it is affordable, it has a lot. So it is something that can be done, but it needs to be done urgently, and it needs to have concerted actions. Thank you.
Thank you, Helena. Very clear. One thing that's come across from you is feasible, affordable to halve the exposure to harmful levels of particulate matter air pollution by 2040. Very well aligned with WHO's target to halve the health impacts of outdoor air pollution by 2040, all air pollution by 2040. But also that we're not doing enough right now. We're far from it, not doing enough, and that multi-sectoral action, as you've all said, is definitely needed. Could you speak a bit more briefly, Helena, about what World Bank is planning to do to support countries to hit these targets?
Yes, absolutely. So the key things that, one thing that we looked at, what countries are doing, what countries have, those who successfully addressed air pollution. And three kind of key things emerge. One is the importance to strengthen the air quality governance. And I think this has already been mentioned, which is embed reducing air emissions, embed clean air into the national policies and ensure that it is supported at the most senior levels. The other thing that I think already has been mentioned is to ensure access to solid, reliable information on air quality and urgently address data gaps and prioritize investments. And of course, to catalyze investments. So help with blend finance to shorten the payback periods of clean technologies and allow a rapid market penetration, facilitate private investments by appropriate regulations, financial incentives of private investors and consumers, and repurpose of harmful subsidies, fossil fuel and fertilizer subsidies into positive investments. And that would be very important. And of course, the repurposing is important because, as I mentioned, about 30% of the exposure is due to outdoor, due to heating and cooking with biomass. And of course, this is residents, so it will be very hard for them to get the investments to do the fuel switch and so on. And this is where it's very important to have the repurposing and to support. And of course, the World Bank, we work with the client countries through multi-sectoral long-term approach in energy, transportation, infrastructure, environment to support knowledge, financing, and partnerships. And some of the examples, for example, in Kyrgyz Republic, the World Bank is supporting establishing a revolving fund to create a market towards scale-up of clean heating technologies in single-family households, ensuring affordability and continuous reinvestment through participating financial institutions. Another example is working, for example, in Turkey, working with the industries to unlock long-term financing through development and investment bank in Turkey for targeted Turkish manufacturers to adopt air pollution and greenhouse gas emissions reductions technologies and processes, basically supporting to catalyze investments and having an integrated approach to climate and to air pollution. Thank you.
Thanks, Helena. That's a perfect note to hand back to Natalia as well. As she was mentioning, kind of the win-wins of acting of air pollution for both health and climate targets. I wondered if you could tell us a bit about what UNDP is doing to support integration of that into the NDCs, the climate commitments that countries should be bringing now to the next COP30 in Brazil. Thanks.
Thanks so much, Nina. And, I think it's important to say that the UN Secretary General has stressed that ambitious NDCs are a priority for the whole UN system. So he did task UNDP to lead the UN coordination towards this next round so that they are more ambitious through the climate promise, but really leveraging the technical expertise, for example, of WHO on health, ILO on labor and just transitions, and really bringing the system together. So UNDP has been the backbone of this work for even prior, but now it is really much more of a broader platform. And the different steps that we're taking as we're rolling it out is, first supporting countries to do a stock taking, of what were their prior commitments, how far have they gone, and what, because that's important to set sort of some groundwork. The second is supporting with analysis, offering tools, guidance, helping fill data gaps. But I think what's important here is we're trying to ensure coordination, target setting, and most importantly, policy alignment between the NDCs as well as other national development plans or SDG work. And this year, I think a big focus is around financing and a key sort of alignment of resources with targets. And here, other sort of key documents are the integrated national finance frameworks for the SDGs and making sure that those speak to each other. But something we haven't spoken a lot about is that the climate promise is also committed to inclusion and ensuring that impacted communities, Indigenous people, youth, women, the elderly, and disabled are meaningfully being engaged. So this is, taking a step back. But health, as I think Helen mentioned, has now really emerged as an issue in these climate negotiations. And we're trying to ensure that health is part of conversations, not just where the health sector is being impacted, but also around mitigation. And with support from CAF, we're trying to specifically integrate air pollution and black carbon into some of these conversations. And this is because we see a huge overlap between the sources of air pollution and as the leading sources of greenhouse gas emissions. So the mitigation co-benefits are huge and often underappreciated. I think Maria spoke to that if you don't think about the co-benefits on health, you might think that the intervention to, say, mitigate energy or your buildings is too costly. But once you start counting the health co-benefits, the costs make much more sense. And, we've been doing this work in trying to integrate air pollution and black carbon in many countries, 10, 15, Ghana, Tanzania, Georgia, Nepal, Nigeria, Vietnam, to name a few. And I do want to give a huge shout out and thank you to the Lancet Countdown, because they're helping us develop country-specific fact sheets so that we can give these to governments so they can understand that what are the key sources of air pollution? And were you going to be doing something, say, on energy or clean cook stoves? How does that fit? So with, this collaboration we think is really important. But, it's clear overall that if NDCs have, commitments for cleaner transport, for green urban policies, for better waste management, for clean cooking, smarter approaches to agriculture or land use, these will simultaneously benefit the climate, our health, and our economic goals. And one last thing, Nina, I just want to say that we're not starting from scratch. And I think it's important to highlight good examples. And we can learn from countries that have done this. Mexico stands out, right? In its last NDC, Mexico already included an ambitious unconditional target to reduce black carbon by 51% by 2030. And then they talked about the potential to go further with sort of support from the international community. And so I think learning from each other and South-South learning is a key priority for UNDP this year, but also after the NDCs have been put forward to ensure implementation, because what we have seen is that setting good, ambitious targets is one thing, but then moving from that to action is the most important part, and ensuring that governments put the budgets and put that commitment forward. So I'll stop there. Thanks, Nina.
Phenomenal. Thanks, Natalia. Heads up to the audience. I'm going to ask one more question to Christie, and then it's your turn to ask questions of our panelists, and maybe, if possible, also Helen Clark, as she's still in the room. So you're forewarned. Christie, I wanted to ask you, I think you said this is your second World Health Assembly. So what have you been reflecting on this week in terms of what are your recommendations that you would bring to health policymakers off the back of what you've heard here?
Sure, absolutely. And I think reflecting on my answer to the first question and reflecting on the presentations that we've had today, a lot of what we've discussed are very lofty and significant numbers, and it's very important to be able to quantify the impacts that we're discussing. But I think to try to bring it back down to the individual and community level is also very important, because these numbers ultimately represent individuals. So I wanted to kind of hark back a little bit. I've talked about phase 3 of the Health Inclusivity Index, but it is not a standalone piece of work. It sits within a 3-phase project. So to give you a little bit of an overview, phase 1 provided the first ever snapshot of health inclusivity. So it looked at policies, strategies, and infrastructure in place to determine the extent to which they were delivering health inclusivity. And then the second phase, we realized, well, we're not asking anybody about how they're actually experiencing this. So we went and did that. We asked 42,000 people across the 40 countries that we analysed to describe and explain their experiences of inclusion and exclusion when accessing health services. So to bring that back, in phase one, we uncovered that people and community empowerment is a key driver of health inclusivity, with 8 of the top 10 countries performing, scoring highest in this domain. And building on this, in phase two, we know that the gap between policy and practice was smaller in low and lower middle income countries, where focus was more heavily placed on community empowerment and community-based services. In the interest of time, I'm going to speed up a little bit to get to my point. Which is to say that the impacts of air pollution on health is poorly understood by individuals, and we know that health literacy levels around the world are too low. So by improving these levels, we can equip people with the knowledge, skills, and support they need to take active self-care of their own and their family's health. So a final finding to share with you that reflects this point is that in the phase 3 of the index, we also analysed the economic impact of improving health literacy. So we know that by reducing low health literacy by 25%, this can have profound positive impacts on annual healthcare costs, with a potential over $300 billion being saved. And we also know that those with low health literacy, on average, have 3 times higher healthcare costs than those with high health literacy. So I think based on those findings altogether, it's our view that targeting and tackling low health literacy at the community level is not only a cost-effective intervention across health, but can also make real difference in mitigating the impacts of air pollution on health at that community and individual level, and also improve access for those who need it most.
Thank you very much. And thank you for the reflections on reaching the community. Absolutely essential. Do we have, Maria, if you want to come back up, you're very welcome. Do we have questions in the room for either of our incredible Common Air Commissioners or any of the panelists at this point? You're unusually quiet. I mean, I know it's Friday, but Marina definitely. There we go. Elaine has a question.
I can ask a somewhat provocative question.
Please, go for it.
Based on some of the informal conversation, Elaine Fletcher from Health Policy Watch, based on some of the informal conversations I was maybe you don't want to hear it. Yeah. Okay. I had heard that the health declaration now is published. I haven't had a chance to look at it for COP, out of the COP, and that it really just focuses mostly on adaptation in health systems. And I found personally that a real concern because, you know, health systems are so energy poor still. You know, WHO did this report on what is it, 1 billion people around the world don't have access to healthcare with adequate electricity, for instance. So there's such a win-win in terms of co-benefits and mitigation in electrifying health services, but I don't see this as being yet a big push in the health sector climate efforts. When I looked at the Green Climate Fund a few months ago, the Green Climate Fund has funded only just funded a health sector project in Malawi, but it had nothing there about electricity. And they've only funded like 4 projects on renewables in Africa anyway. So I just see this big gaping hole in terms of funding renewables in Africa, which would really create gains for climate and air pollution. And also, so I just wonder if anybody can address this declaration, or what your groups are trying to do to maybe improve it, or what else we can do to push along that agenda. Thank you.
Thank you, Elaine. Can I address the Belen Health Declaration question to you, Maria?
With pleasure.
I can vacate the chair.
Thank you very much. I don't see any representative from Brazil, so happy to take it. As you know, Brazil has presented at the high-level event on Monday their plan of action, and now there will be a call. We will have a global conference on climate change and health in the Brasilia end of July, where we will have looking at a lab of ideas. So we are calling for ideas on interventions that work, and probably the one that you were describing about solarization with solar panels of healthcare facilities is one of the ideas. You do mitigation, adaptation, and at the same time benefits for air pollution as well. And there will be a 3 days conference on health plan of action. They will be looking at innovation. They will be looking at monitoring, surveillance and early warning, and of course, interventions that work in terms of adaptation. It will be a very good agenda on health action. And hopefully we will take that and to COP30 in Belém at the end of the year, I mean at the COP. On behalf of Brazil. Obrigado.
Obrigada. Thanks, Maria. Yes, absolutely. The one thing that's been striking me all week when we're talking about the Belém Action Plan is we can't adapt to this. It's like bailing out a boat that's still sinking and has a massive hole in it. So there has to be a mitigation focus as well, no doubt. And I can see, Natalia, you have your hand up, or were you going to say exactly that?
No, I was just going to add that, this area of energy access is a top priority for UNDP beyond just the health sector, right? It's, how do we think about ensuring that people have access to energy so that they can go to school and, but in the health space, we do have, again, learning from good examples in Zimbabwe with savings from Global Fund resources, actually. We made a case, I think Helen probably remembers, it may have been under Helen's leadership, making the case that, to maintain the quality of, vaccines being kept at the temperature we needed, the quality of services we needed, reliable access to energy, and that had to be clean. We don't want just diesel there polluting the communities. And we were able to use Global Fund resources to electrify Zimbabwe's health system. At this point, I have heard from the Minister of Energy of Zimbabwe through our RC that it actually feeds into their system. Like they have more solar panel because they've electrified so much of the health system. So I think highlighting some of the wins for the governments, that it actually can be a saving. It's good for the health sector, but also for their entire development plan is important. So UNDP, UNICEF, WHO, I know we are thinking collectively about how we solarize our health systems. And I think we should see that as a commitment to ensuring that energy poverty is addressed. Like those two have to go hand in hand, addressing air pollution and energy poverty, because otherwise we do have the biomass, the collecting fuel, all the harms that we haven't talked about that relate to gender equality as well as other things. So just wanted to highlight that this is top priority for UNDP, and whether or not it's in, the health sector focus, it will be at COP, I think. Thanks.
Thank you. That energy poverty point is absolutely vital to be relevant to discussions anywhere right now. Yasmin, my colleague from Clean Air Fund, is going to relay a question we've had online.
Great, thank you. So this is from Louise O'Leary, who is highlighting the growing evidence of mental health implications of air pollution, especially from exposure prenatally right down through the life course to dementia as well. So how can mental health services, but all kind of disease area services, advocate, increase awareness and improve and response to this?
Thank you for the question. Any of our speakers want to take the point on mental health, or anyone in the room speaking from a mental health perspective? Definitely, this has to be quantified in, and I think there's been a really healthy focus on mental health as part of the NCD agenda here at this WHA. So I think, agree with the point that Louise is making online, that this needs to be a part of also when we're talking about the economic value of cleaner air, that we try and quantify both mental health and neurological health advantages as well. Okay, I think we had a couple more questions in the room. Sarah, if I may. Marina, did you have your hand up, or do I just expect you to have your hand up?
Yeah, I can speak.
Okay, wonderful. Okay, I'll come to you.
Thanks. So my name's Sarah Rylance. I work in the non-communicable disease department at WHO. My focus is on asthma and COPD. I just wanted to highlight an opportunity really, because I think you've been talking a lot about how to make sure that we emphasize health when we're talking about air pollution. But the flip is true as well, to make sure that air pollution is mentioned when we're talking about health and particularly chronic diseases. And hopefully today we'll have a resolution that will be adopted on lung health. And this is a very broad resolution in its scope. It includes communicable and non-communicable lung diseases and associated risk factors. And it's really looking at how do we ensure that we're thinking about prevention together with diagnosis and management. And it will be a difficult or challenging resolution to bring forward into concrete actions, but I think it is an opportunity. So I just wanted to highlight it really, that it's important when we're thinking from the disease perspective or the health perspective that we weave air pollution into all of this. And I think the resolution will hopefully promote and encourage countries to really think on the ground when we're looking at primary healthcare or other health systems, how do we link air pollution and other relevant risk factors, tobacco, occupational exposure, etc., into our disease management programs. So just to highlight that, thanks.
Thank you for, oh, we've lost energy. Thank you for adding that, Sarah, highlighting that, Sarah. If you could pass the mic, Yasmin, first to Eric and then to Marina, and then we'll come back to our speakers. Thank you.
Yes, hi. Hi, I don't think this is working, that's okay. Oh yes, now, thanks. So I'm Eric from the Union for International Cancer Control, working the Clean Air Fund. I just had a question on the figures impacting health, the economic impact also, because in terms, certainly in the cancer space, we're trying to look also at the immediate impact on people who are struggling with the disease and going through treatment. And I'm wondering if they include those, because we often think, okay, air pollution contributes to lung cancer, you develop it, sort of a long-term thing, but people are actually going through chemotherapy, they are affected by air pollution, their treatment may be delayed, and their survival rates may be, their chance of survival may actually be impacted, and they could die from that. So I'm just wondering if there are studies on that or if they're included in the figures.
So first we'll take Marina, and then we'll come back to the panel for your responses. Thanks.
Thank you. I have more of a comment, but I think there's some elements here that could be interesting to hear your thoughts on, because what I think we're trying to get to here is integrating energy as a determinant of health, right? Both from the point of view of air pollution, but also from the point of view of energy as a fundamental health determining service, access to information, to education, the potential to refrigerate medications, to maintain healthy indoor air temperatures, and keep our food. So I think we need to do a redefinition of health systems, of energy systems, of fundamental health determinants. And I was wondering there, what type of conversations we need to have with agencies like the IEA, of the extent to which they define a health agenda when they define their own energy access agenda.
Great question. Sorry, I think we had one more question in the room from Laura, and then we'll come back to the panel.
Thank you. Laura Jung from the German Alliance on Climate Change and Health. I have a question to Helen, actually. So you were on a panel at the beginning of this week on health taxes, which was focused around like tobacco, alcohol, and sugar. But do you see an opportunity in taxing air pollution as well in the same way and using that money for health protection?
Could be carbon tax, I guess. That'd be the most obvious way to do it, to tax the pollutants. With the global health financing cliff at the moment, we're looking for new areas of revenue, right? So that's certainly one. I absolutely agree with Marina about focusing in on energy. And I think traditionally with energy and development, there's sort of been the view, well, people just need access to energy. It doesn't matter where it comes from. That's clearly disastrous for climate. I think there's been comments made about the focus on health, being on adapting to the burden of disease and illness that's coming down the track with climate action. But we can't adapt our way out of the crisis. We all know that. So while the systems have to be ready for what's already upon us and what is upon us in the foreseeable future, yes, the health system has a responsibility itself to be looking at where it can bring down its carbon footprint. I recall actually Natalia reminding me of UNDP projects going to Uzbekistan years ago, and UNDP was retrofitting the rural health clinics with solar panels so that if there was ever a power failure, the vaccines and the test samples could be kept. But actually the whole system needed to be sustainable, not just the backup. So there's a bigger vision there.
Thank you so much. Great. Do either of the panelists online want to take the question on whether cancer prognosis is costed into any of your work so far? Go ahead, Natalia.
I can jump in. I don't know if it's specifically, related to cancer, but we do take into account productivity losses and sort of absenteeism, so missing work, but also presenteeism, so being there but not at full capacity. So I think indirectly we are taking into account sort of the the impact that goes indirectly. I don't know, and I'll talk to my colleagues about caregiving, because I think that's something we overlook often. And so the gendered implications of sort of who is taking care of people who, so a child with asthma who has to go to the pediatrician, like that may be caught in the productivity losses and absenteeism. But I don't know if we've done, I think there's more analysis that we can do to highlight that, but it is captured in our methods. Thanks.
Yeah. And the cancer prognosis studies, these are emerging. UICC is doing a great job of synthesizing the evidence around cancer and air pollution. And they've emphasized some new studies that have come out saying children with pediatric cancers, their survival is lower it's very logical, but it's proven now by studies. Survival chances are lower in places with poorer air quality. And the same obviously goes for lung cancer as well. But the evidence, this is a kind of emerging part of the field. Helena, you want to add?
Yes, so the analysis of the averted mortality, it took into account lung cancer, but yes, we did not do specifically prognosis of the lung cancer. So it does, the averted mortality due to lung cancer is included.
Thank you. Thanks. And thanks for the points from the audience as well about what comes next. I think it was Sarah Rylance from WHO raised the NCDs, and there's also a high-level meeting. So heads of state and government will be meeting at UN General Assembly in September on NCDs. We're really disappointed with the zero draft in terms of what it doesn't say on air pollution right now, so hoping that can be beefed up by September. Gosh, we could talk about this all day, but I really, really can't. And I want to come to just a couple more members of the audience for your reflections on what you've heard so far. Apologies for cutting you short, but stay for food and drinks afterwards and we can keep the conversation going between us all. So at this point, I'm going to hand to Chris Carter, who's Deputy Director of Global Health at UK Foreign, Commonwealth and Development Office, just for reflections on what you've heard today. And then Aoife, who I no longer see. There's Aoife Kirk. Wonderful. Pop up and feel free to take the chairs if you like.
Shall I go first? Okay. A lot of powerful arguments there. Really good session. I mean, at the heart of the investment case is, of course, the 8 million deaths a year, the 6% of GDP that is lost. And we shouldn't forget that. I mean, we did hear that they needed to be country-specific and granular enough so they can lead to action. And that's important. We talked a lot about why there is so little action, considering these terrifying impacts. I mean, I think people just don't know, or they don't believe what we're saying. And advocacy, many of you work on advocacy. What you're doing is critical on this area. And getting that right at the different levels. We talked about advocacy at the government level, but it's also at the sort of community level, the multilateral level. We did hear, though, that there is other causes of inaction, like vested interests, the fact that it doesn't really fit into under one ministry, budgets are tight, and it's cross-boundary. Looking at a more positive aspect of what we've been talking about, the WHO conference in Cartagena was a major step forward, and that commitment to reduce health impacts of air pollution by 50% by 2040 will be transformational. The UK is firmly behind that commitment, both in terms of its own action and that picture's just been taken. Its own action and but supporting other countries on that as well. The thing is with commitments, we all know this, there has to be accountability built in. And we're going to have to think really hard about that accountability on this area, considering it doesn't really fit under one ministry. I think the WHO's roadmap is an important piece of the puzzle. It was interesting to hear about One Health resolution as well. They will give us a robust framework for implementation, but they are pieces of a puzzle. There are many pieces to this puzzle, and that came out from the questions. Implementation also has to be sensible and value for money. We talked quite a bit about the co-benefits, particularly with action on climate change, health, and economic growth. They really have to be brought out, and that integration piece, the UK, I talk a lot about integration. It's fundamental. We shouldn't see this as a standalone issue separate from everything else we're working on. If we do that, we're not going to act because it's too much. If we integrate and we work and implement sensibly, then we will act. Just one example, decarbonisation planning and air quality management. The World Bank has done a study, there's huge benefits to doing it that way. We heard, I think, from Helen that the money going to air quality is pathetic. Was that your word? I agree with that. It's equitable. Low-income countries getting the least support, almost no support. The UK is trying to do what it can in that space. It supports the Africa Clean Air program. Many of you know that program. We see it as a vital initiative at addressing air pollution and climate change together, that integration. And it's AU-led, so it's an Africa plan that we're getting behind. But we need other donors to support that. So if you're a donor, we also co-chair the Climate and Clean Air Coalition with Brazil. And that's so that countries can work together. And that came out a little bit there. We're working hard to make sure that health is a bigger part of that, which we think is going to be important. And we heard quite a lot about new reports, about new tools, about the importance of data, standards. Again, you know, it's about making the best use of those, using them effectively. As part of the Clean Air Coalition, we've created this platform, AQMX, Air Quality Management Exchange. So it's an online platform, but it's trying to bring all together and really trying to focus on making the best use of all those resources that are coming out. And just my final point is, it's a big year already this year, right? It's going to be a big year on air quality. And we've got at the end of the year in December, the UNEA 7. It's a real opportunity for that accountability. And COP30, as we've talked about, is big. And just to finish with the new NDCs, I'm really glad they came out strongly here. They are fundamental, both for the UK, but for each country. If we get it into the NDCs, it will mean they become priorities of those countries, and it means we'll get the reporting going on. It means that there will be actual real action. It's fundamental. Thanks.
Super, thank you. Am I working? Yeah. Thanks so much, Chris. You've made my job much easier. So no, it's great. So I'm going to keep it short and sweet. My name is Aoife Kirk. I'm a medical doctor. I'm currently working as a clean air lead at the World Economic Forum. And instead of giving you statistics, I'll actually give you a story about how I came about air pollution. It was just after I moved from New Zealand, where I was working in the emergency department, to London. And I started getting these spontaneous nosebleeds for about a month. I couldn't figure out what was going on. And it was morning and evening. And around that time, I was getting environmental health lectures from Andy Haynes and other lecturers. And I was like doing my own little case study, case research, until I realized I was taking the tube every morning. And it was before the WHO guidelines had come out. And now that I realized it was actually about 25 to 30 times higher than what we should be breathing. So for me, this was a real opening to actually what we've discussed about here, what Chris is saying, that advocacy, and actually for me as a medical doctor to say, wow, I was never taught about this in med school. And I'm so grateful to WHO for creating those resources now for healthcare professionals to actually recognize, as Nina was saying, that this is the second biggest risk factor before smoking even for our health. Over the last 18 months, I've been working with a group of experts. In true World Economic Forum fashion, it's been private, public, civil society and academic experts in the field, really to identify the opportunities that we can maybe shift the needle on where an opportunity may be on air pollution. One of the opportunities we did identify was actually one of the statistics we've heard today around financing. So only 1% of international development financing goes directly towards clean air projects. So we decided to look at development financing institutions, be it the World Bank, Africa Development Bank, Asia Development Bank, all the financing institutions, to see from both a top-down approach as well as a bottom-up approach what the needs may be to start to integrate in air quality. And there was a need, it wasn't being looked at. So with further research, we identified that there is a gap, in particular for project officers, to start to integrate in air quality into the different aspects of their funding. So we spoke here on energy, for example, waste, transport. A lot of these areas fall between the gaps of private public and actually are funded by development agencies. So for us, it was a huge opportunity to actually educate with regards to what that would look like. So a success story, because it was brought together very, very quickly. As you know, these things can take some time. And we're very happy to say it was launched thanks to Clean Air Fund at the World Bank Springs meeting. So you can download it there. It is a public available access tool. We launched it and it was curated. It was basically incubated as an idea with the Global Future Council on Clean Air, but it was curated with Clean Air Asia, Asia Development Bank and Ricardo Consultancy. And we are delighted that we had it endorsed by numerous different agencies. So Agence Française Development, Inter-America Development Bank, German Development Bank, Japan International Development Bank, and Expertise France. So from that perspective, it's been one step forward. As we all know from World Health Assembly, it's all about those little steps forward, but actually the integration, the upkeep and the implementation of it is really where the success lies. So hopefully we'll come back with further results on that, because we're delighted Clean Air Fund are continuing that work, going to train up the project officers on how to actually use this toolkit. So it's not just sitting there as a toolkit. So to finish off, I do want to say it is a priority at the World Economic Forum, pollution in general. From the private sector side, we launched the Alliance for Clean Air at COP26, I believe, where we're looking with multinational, international corporations on how to report and reduce their air pollution emissions. In particular, as we know, Scope 3 is something that needs to be tackled by the private sector. As well as that, pollution is identified as a global risk by the forum stakeholders who carry out the survey each year. And that in the 2-year risk came up to 6th place last year. And it's also identified as a risk over the next 10 years. So for us, it's a real indicator as the UNFCCC triple crisis really around biodiversity loss as well as climate change. And I mean, the three go together, right? We all know that in this room and online. I'm going to finish off just by saying that as we're coming to the close of this very busy, informative week, it is really about the collaborations and the network that we drive forward here together. I think that we build the future as hopefully as clean air, not just being an exception, but actually being the expectation, because as you have heard from all the statistics today, and from the financing aspect, we really need to identify where those key areas and those acupuncture points are that we can drive the action forward. So I want to finish off by saying Míle buíochas in Irish, so 1,000 thanks to our amazing panelists that we brought together, Maria and Helen, to our panelists online, Christie, Natalia, Helena, and to Chris, and of course to Nina.
Thank you so much. I apologise for keeping you a bit longer than promised from your delicious viewer bar lunch, but please stick around and have something to eat and a drink with us. Yes, thank you so much to all of the speakers from this event, especially those who have joined us from different time zones online. Natalia, Helena, thank you so much. And the audience online, I know very numerous. Thank you for your questions. They already have the links to the reports that we've talked about today. The rest of you will get them by email after this event so that you can please, please, please use all the phenomenal facts and figures that we've heard, such compelling evidence for how we take the momentum from this WHO, the WHO roadmap, hopefully the Global Action Plan on Climate Change and Health, the Lung Health Resolution, through to COP, through to the UNGA high-level meeting, G20 and so on. The opportunities are huge. Big thanks one more time to Helen Clark and Maria Neira. And stick around and keep the conversation going. Thank you so much, everybody. Thank you.